Dr. Chanchal Goswami, thank you so much for doing this with us. So I'm going to dive right in, and I wanted to ask you the first very pertinent question, which is how do you think cancer care has evolved in the last 10 years?
At the outset, I think I should thank you, Samara, for giving me the opportunity to be in this conversation, because last time when we met, you have discussed these things with me, but it has been a long time, and I'm glad that it has finally taken shape. Now, answering your question directly, I think I have been in oncology for the last 3 decades. So almost 30 years of practice in oncology. And I have seen a lot of changes in oncology over the period of time. If I want to enlist some of this, the first and foremost is the outlook of clinicians and outlook of patients for oncology. Clinicians earlier used to think that oncology, most of the patients are going to go for palliative care. They are not going to make it. So there's not much worth in it, and not spending so much time and everything. And that was the outlook not only for oncologists, but for general physicians or general practitioners who used to be the first representative of those patients to the doctors. So I think that outlook has changed, and now the general physicians have understood that oncology is something which is a highly specialized subject, and it should be treated by the properly trained physicians who are well trained in oncology. Not only that, they know that there are subspecialties of oncology like surgical oncology, medical oncology, radiation oncology, palliative care oncology, so on and so forth. So these are, and also the physicians have understood that there is a huge psychological element to the treating oncology patients. So psychologists and psychiatrists also need to make a part of it. There are radiologists, pathologists who also come into the multimodality part of the treatment. And of course, nutritionists, which is an important aspect because they were totally ignored earlier. So this is the change which I have seen from the physician's point of view. Now, coming to the most important person in the oncology ball game is the patient itself. The patient have understood that cancer is a disease which can be treated, and many a times it can be transformed into a chronic disorder, and one can go on for years together of treatment. Thanks to modern medicine, newer medications, and understanding the cancer much better by clinicians. So patients have also understood, and they are keen for two things. One is to get treated by an expert, and one is to get treated in an expert institute, an institute which devotes themselves to oncology care. So these are, they don't want to go into run-of-the-mill places or run-of-the-mill physician. They want to go for a specific, and more so, they want to go to people like, say, for instance, they would like to go to a lung cancer specialist or a breast cancer specialist or a GI cancer specialist. So this is a definite change in attitude from the patient's point of view. The other thing which is very important, and I think they are a much more important cog in the wheel, which we have altogether ignored for a long period of time, is the caregivers or the patient's relatives, because they also form a big part in the treatment management. Earlier thing which used to happen, there was a hide and seek between the patient and the patient relatives. That thing has gone. So the relatives have understood that the patient need to know about the disease condition. They need to understand what is the prognosis. They need to participate in the disease treatment. So getting all these things together, apart from the development in diagnostics and development in cancer medicines, I think this has all together transformed the scenario of oncology management in India, and the result of that is survival benefit. Patients are living longer and living much better. And the most important thing, the patient have also understood the importance of patient-reported outcome, the quality of life. So taken all together, I think 30 years back when I started my cancer practice, and after 30 years today when I have turned 60, I see there has been a sea change in the treatment and outlook of oncology management.
Something very, very important. something that we tell our patients a lot, that it was just a short few years ago where we were treating cancer as something, or our mindset was that it's more terminal in nature. But today you said something very interesting, saying that we can treat it as a chronic disease more than something that could actually take your life. What do you think are some of the factors that come into play when we start managing cancer more as a chronic disease than one which is can be life-threatening?
Yeah, where majority of the patients have out-of-pocket expenses. I think finances take a front seat in the management of cancer. So as a clinician, I have to understand the disease profile of the patient, how much I can do and to what extent I can make him feel good or make her feel good and increase her lifespan. That is one important aspect we have to do at the outset. The other thing is that what sort of medication which will be right for that socio-economic status of the patient. So as a clinician, I not only have to play the role of a clinician, but I also have to play the role of what should I say, a social worker. For that matter. So understand the socio-economics of the patient relatives, the patient and the family structure of the patient, how much of support he can have or she can have from the family, what sort of an extent of treatment he can go about, because it's not that what I prescribe on day one will continue through the rest of her or his life. So treatment will change according to the disease response. So I have to understand, and the most important thing what I do and what we need to do as a clinician, that when we see a patient X, we have to have a plan A, a plan B, a plan C for a particular patient. So if plan A works out, then when to implement plan B, or if plan A doesn't work out, how soon I have to implement plan B, and all these things keeping in mind with the disease profile, the progress or the response of the disease, and the socio-economic background. Now, the socio-economic background changes. Today, a person may have a job. Tomorrow, the person may not have a job. As we have rightly seen during the COVID pandemic, people have lost jobs. So people who have been otherwise well settled suddenly have the sky has fallen on their head. So these are all things which has to be taken into consideration. So it's absolutely a dynamic process where you have to modify your decisions every now and then, keeping the patient relatives, the socio-economic status, the disease profile, and the outcome of the treatment in mind.
And you also brought up something very important, which obviously CARER condones and is the foundation of what we do, is integrative lifestyle care, and using lifestyle management therapies like nutritional support, physical, psychological support, like you spoke about. I would love for a doctor of your stature and credibility speak a little bit about this, but how integral do you think this has become a part of mainstream cancer treatment and care, and a part of the treatment journey for a patient?
You see, cancer, in majority of these cancers, except for a few cancers, cancer is also a lifestyle disease. Say, for instance, lung cancer or a head and neck cancer, to a certain extent, breast cancers, they are a part of the lifestyle disease, even GI malignancies. So lifestyle management is an important part. And lifestyle management means there are 2-3 things of lifestyle management. One is looking at the habits of the person, what sort of habits they indulge in, what sort of a food they take in, what sort of a lifestyle, what sort of a work lifestyle they have, how much of work pressures they have, what is their physical exercise part of it, because in general, I believe Indian patients lack physical exercise. They do lack a good nutritious diet. They have a lot of diets, no doubt about that, but they usually have spicy diets and chatpata khana they prefer. So I think these are important because all these factors which I mentioned, like the habits, the diet, the physical exercise, the work pressure, all these things, and the pressures at home, because the Indian family is a compact family. So a patient who's a cancer patient, he does not only think about the cancer and the disease, but also thinks about his wife's marriage, his son's education, his elderly mother's treatment, and so on and so forth. So, and saving money for her daughter's marriage. So these are all part of the, by work pressure, it doesn't mean that it only has to come from your work, office work. It can also come from your family work. So I think these are all important aspects, and that's why I feel that unless and until you integrate the family members into cancer treatment, you can never achieve what you are trying to achieve. So when we are integrating, or we look at holistic approach to cancer management, I think these are the issues which has to be highlighted. If you have habits, one has to take care of those habits, take care of it. You need psychological counseling for that. To quit those habits, you'll have to do. You need nutritional and dietary counseling, not only for yourself, the patient, but also for the family members. But because each one of them is at risk, because ultimately the dietary habit which is there with the patient is also there with the family members. They are also with the same dietary habits. So if it is a faulty dietary habit for the patient, it is also a faulty dietary habit for the patient family relatives. So that has to be taken care of. If you have to take care of the work pressures, that has to be counseled. And of course, the psychological counseling part of it is there. So taking all these things, it's a huge challenge, no doubt about that, Samara. But I think it has to start somewhere. Indian cancer patients has not been treated holistically for a long, long period of time. We have only looked at the disease and the patient and tried to shrink the tumor. That has been our approach. But we have understood that that's not all, and that does not give you the best of results. So you need to have to look at many other things other than the tumor and the patient itself to give the best results for the patient.
You spend so much time speaking about caregivers as well, something that we completely ignore because we put so much attention on the patient that, what happens to all the members of the family that have also put their attention on the patient and kind of almost stopped their lives. Everything has come to a standstill. Can you tell us a little bit about how a caregiver can care for themselves and that it's okay to take some time off? It's okay to have a little bit of self-care in this journey of caring for a loved one who's going through cancer?
In my cancer practice, what I have seen, there are a few types of caregivers. One caregiver is that who takes all the onus on themselves. I would not like to have those caregivers. They will take all the onus. They will decide on the treatment. They will decide on the doctor to choose. They will decide on what sort of a diet they want to have, and they would keep the patient away from to face those all. They are too protective, overprotective about the patient. I think that doesn't make sense. There is another part of caregiver who actually themselves need psychological counseling because they are more unnerved than the patient itself. And they look at all the worst effects of cancer. They will give you stories of which cancer patient died, which cancer patient suffered. So they are another bunch of caregivers, which I think we would not like to have. The best caregivers, which I personally feel, who actually empathizes with the patient, not sympathizes, but empathizes with the patient, understands the problem, is open and discusses everything with the patient, and actually looks into all the aspects holistically and consults with the doctor and the patient together. So it's a sort of a multidisciplinary team. The way we do treatment for cancer patients, like with multidisciplinary team, this is the holistic approach of them. And I believe if we incorporate a psychologist into it, that would be the best part of it. The psychologist, the nutritionist, the caregiver, the patient, and the doctor. This becomes an essential core team which looks after the holistic treatment management of the patient. And these caregivers, they help. Actually, what happens? Our patients are fortunate that we have caregivers at home. If you look at the Western society, many of these elderly patients, they do not have caregivers. They depend solely on the infrastructure they have on those countries. Though I understand those are beautiful infrastructures, but they have a cost attached to it. In our society, our patients are more attached to their family members, and they would like to be in the own surroundings more often than a Western society. And here, I think our patients are blessed in that sense that we have caregivers and multiple of them in the family who can, sometimes it can cause a nuisance, but at times it can be very beneficial for the patient as well, because they can rely on these people and express themselves, because many of these patients are not so expressive in front of their doctors because they have a myth uh, about the doctor, that the doctor is something whom I cannot say everything, or he is something which is actually, we are most of the time kept in the pedestal of the god, which is detrimental, because आप भगवान के पास सब कुछ कह नहीं सकते, आप मांग सकते हैं बट कह नहीं पाते, बट डॉक्टर के पास भी वही, आप you can expect the doctor to do everything, but you may not be able to tell everything. So there the caregivers give a lot, and I think it would be nice if the caregivers and the doctors also treat the clinician as a human being who's just like them, and that gives the best result. If you consider the doctor as your friend and a guy who is going to give you the help in need, I think you get the best results of.
Dr. Goswami, when we talk about cancer, we have to go back to a very important element. Unfortunately, when a country, I keep saying this, where we are very reactive when it comes to healthcare, we're not very proactive. As much as we want to do the best we can for the patient when diagnosed with cancer, help them recover faster, expedite healing, give them the best chance for survival and recovery, it all goes back to prevention and early screening and detection. So just to end this, I would love for you to, talk about how important it is to be proactive when it comes to something like cancer, where it's a type of a disease that the earlier that you actually diagnose it, the better the chance of cure and survival. So what are your thoughts on that?
There's no point in overemphasizing the role of prevention in cancer. But unfortunately, even cancer being such a disease and so varied in nature, every cancer do not have a preventive management, I would say. Apart from breast cancer, colon cancer, some head and neck cancers, we do not have much role in prevention. But at the same time, as you rightly and what we have stressed upon earlier, if you do lifestyle management at the outset, you can prevent a large number of cancers. So lifestyle management is like a broad preventive act. So instead of going into specific cancer prevention, you can do a broad cancer prevention by lifestyle management. So what are those things? Exercise, good dietary habits, good healthy habits, and not to have addictions, be it tobacco, alcohol, whatever it is. So these are in general. Apart from this, you need to understand if you have a risk of cancer in the family. So if you have those members in the family, many a times we do not have medical knowledge about our forefathers, what they died of. Many a times we know that they died of some disease, but undiagnosed disease, whether it was cancer or not, we do not. So we do not have the complete family tree. We may know the names of our grandfather, great-grandfather, great-great-grandfather, but we do not know how he died. So that's our problem. So I think knowing that family tree is important. But apart from that, we must understand that 15% of cancers are familial, that is, it runs in the gene. 85% of cancers are sporadic. So if we have a cancer particular risk in the family, we should be more cautious, particularly for colon cancer, prostate cancer, breast cancer, ovarian cancer, so on and so forth. So there, I think you need a much more preventive, energetic preventive action, and doing your tests regularly, be in touch with your doctor, and do a regular screening program. That's important. Other than that, I think the other important thing is that each one of us, I don't want to make it sound like I am talking on behalf of medical insurance companies, but I personally feel Indian population do not have proper knowledge of medical insurance. And they need to have this medical insurance, because when actually the lightning strikes, then you don't know what to do. Because either you don't know what to do because you have diagnosed the disease late, or you don't know what to do because you run out of finances. You do not have adequate cover for you. You have saved for your daughter's marriage. You have saved for your son's education in the foreign country, but you have not saved for your own health. So I think that is important. you need to be aware. As far as medical insurance is concerned, there are so many cancer-specific medical insurances available, which actually gives you good medical cover. And what happens, Samara, it takes away a big headache out of you if you get diagnosed with cancer, even in the early stage or in the late stage. So I think this awareness, like we need to make people aware of cancer, aware of the risks of cancer, aware of the good habits, or what should I say, aware of the lifestyle management of cancer. We also need to make them aware of managing their finance and saving for not only cancer management, but anything, even that can be a road traffic accident or a heart attack or anything of that sort. There are so many diseases which can cripple you for life.
I'm so happy you brought up the insurance part of it, because we are also starting to work with insurance companies, and while you can cover yourself for cancer today, and it's so important, and like you said, finance plays such an important role in how you even respond to your entire cancer journey. Also just being covered by having these lifestyle programs even when you go through cancer treatment, and that's why we started actively working with insurance companies. One is to improve their quality of life while they're going through treatment. Second is also to obviously expedite their healing and recovery. And third, which has been very interesting, is to see that by improving the lifestyle of a patient when they're going through treatment can actually potentially decrease the overall cost of cancer treatment.
Yeah.
And that's because you're making a patient healthier. They have less chance for susceptibility to infection, or coming in, visiting a doctor, or the need for hospital care. So insurance is becoming a very integral part of prevention, treatment, healing, recovery, rehabilitation. So I'm so glad you brought that up. Dr. Goswami, thank you so much.
I always usually, Samara, before we close out, I usually
Yes.
have a slogan usually for my audience when we do this cancer awareness. I say, why is detecting cancer early important? Because when you detect cancer at an early stage, your treatment is the least, your duration of the treatment is the least, and your cost is least, and your outcome is the best. And when you diagnose cancer at a late stage, your treatment is never ending. Yes, your cost surmounts, and your cost is never ending, and your outcome is very poor. So that is the importance of cancer detection early.
It's just really, really encouraging and wonderful to talk to doctors such as yourself that is propagating holistic care for their patients, who's putting their patient before the tumor or the treatment. And we really thank you for everything you have done for cancer patients and survivors and caregivers. And and I hope to meet you again very, very soon.